We have put a large part of our planet into an induced coma in order to save possibly 4%, many of them elderly and sick, of an incredibly overpopulated planet. My question is, will it be worth it? And do we need to have a more pragmatic attitude to death?
Jodie McVernon.
Look, I've been listening to all of this, and I think in Australia what we really don't appreciate is what we have been spared. We have not lived in a situation where we've used ice rinks as makeshift morgues or refrigerated trucks outside, hospitals, and these are things that are happening in other high-income countries. So I think it's far too simplistic to say we're taking all these measures to save older people's lives. We've seen a very large number of cases in people across the age spectrum. We've seen severe cases and deaths in people across the age spectrum. And we've seen whole health systems, really struggle to cope, not just with COVID, but with other health conditions when this disease is allowed to run rampant. So there are very many health impacts across the age range of having an uncontrolled COVID epidemic, and we need to really take that into account rather than think of this as a simplistic age trade-off in the sorts of harms that we're trying to prevent.
The criticism, Jodie McVernon, that is levelled, though, is that we've made these decisions to effectively shut a lot of the economy down based on modelling that showed that by around about now, our hospitals would be at capacity, the ICU wards would be over capacity. I mean, was the modelling wrong?
We've averted that. No, we've averted that, and that's the thing. Our government listened to these predictions at a time when many others didn't, and that's why Australia has not had to go through that. And now we're on the life raft, as we say. We're at a point where we're in control of the situation, and there is time for this complex societal discussion, and I completely welcome that. I think as public health practitioners and as the health experts, we helped Australia avoid that crisis. But yes, we all agree that now to work our way through this needs a much more balanced and nuanced conversation about who we are, about what we value, about how we protect all of our health needs, and about how we open up and protect our economy and future society. All of those things need to be balanced and measured, but it's not an all or nothing situation.
Jodie, your team, you lead a team that provides this modelling to government. It's been relied on throughout this. Has this question of lives versus lives been considered in the big decisions that have been made here?
So the modelling that we've done has really been about the COVID epidemic, and we haven't been addressing other causes of life lost. So that clearly was not part of the modelling that's been done. We're not economic modellers, we're not looking at other health impacts, and we're all aware of the adverse health impacts of lockdown and the adverse health impacts long term of an economic downturn. But now, having got to a point of stability, we're in a position to be able to navigate our way through those next challenges with a measure of control.
Gigi Foster, I can see you raising your eyes there.
What frustrates me about this is when people talk about the economic costs of the lockdown, they often don't think in detail in terms of counting lives, as we do with the epidemiological models, for example. So has anyone here actually thought about how would you get a measure of the traded lives when we lock an economy down? What are we sacrificing in terms of lives? Economists have tried to do that, and we try to do it in currencies like the value of a statistical life, or the quality-adjusted life year, or the well-being year. And those quantities enable you to think about lives on one side versus lives on the other. And I mean, if you do that kind of calculus, you realize very quickly that even with a very, very extreme epidemic in Australia, we are still potentially better off not having an economic lockdown in the first place because of the incredible effects that you see, not just in a short-run way, but in many, many years to come.
How can you say that? How can you say that? Like, we're avoiding what's happened in the UK, what's happening in the US. The idea of having our ICUs overrun, our healthcare workers dying as well, is just the most horrible thought.
It's horrible. It's horrible either way. The coronavirus has made the world awful. I mean, there's absolutely no doubt about that. But in order to have a proper discussion about trade-offs, you need to think in terms of lives that you're giving up. And I know it's invisible lives, and it's difficult to imagine that when we aggregate, for example, all of the health effects, all of the mental health effects, all of the effects of people right now who have illnesses other than COVID-19.
But Gigi, I don't accept the premise of the argument you're putting, that this is simply two things where they're fixed in their response. I mean, I'd ask you, I'm not an economist, but if I said to you, look, we have had the lockdown and we now want to put in place economic measures and other social measures to minimise the other lives that might be affected, I imagine you'd come up and you say, well, if we were to do these things, so you have to take the lockdown as the starting point, but if we did these things, they would have a very positive effect in minimising the very concerns you're about. And I'm wondering, what sort of policies would they look like? Are they the sorts of things that Sally's describing or Nev has in mind?
So I definitely think the lockdown itself, now that we are in this stage, right, we've already caused much suffering. We've already caused many lives.
So how do we offset that then?
It's very difficult. I mean, a functioning economy delivers welfare, you know, the best of any system that we've ever come up with as a human species. So
Jeannie,
to address that by going in and having stimulus packages, of course, it's much better than if we didn't have those stimulus packages. I completely agree. The JobKeeper program is fabulous. I love that. Those were not actually on the table when we first started talking about lockdowns.
Nev Power's trying to get in.
Yeah, sorry, Gigi. One point that I'd like to make is that the way that the virus has been managed in Australia is probably going to get us back into easing the restrictions and getting our economy back quicker than if we had let it get out of control. Because if we look at countries where that hasn't occurred, then the impact on their economy has been even far more dramatic. So I don't think that there's a solution here that says it's one or the other. It's much more nuanced to that, and protecting people and keeping people out of hospitals will allow us to ease the restrictions much more quickly than if it had run rampant.
Well, I think it's much too early to be able to tell for sure what the full economic impact is going to be of what we have done to ourselves, because this is not going to be a V-shaped recovery. Recoveries don't come in V-shapes. We have destroyed network links. We have, you know, severed our overseas trading links in a lot of cases in many industries. Now, some of these JobKeeper program type payments and programs will allow us to retain some of those links so that the employers and employees don't have to reform. But that process of reforming and getting the economy geared up again, that takes a lot of time. So we're not going to see the full economic impacts for at least a year or more.
But we've got time. We don't have what could have been 10,000 lives. Like that's the difference.
Again, have you done the calculus on the other side of the equation?
Are you talking about lost opportunity? Or
I'm talking about lost lives. I'm talking about quality adjusted life years, which is the normal currency that people use when they're making decisions in developed countries about how much to spend on saving people's lives. Because we always have to allocate resources. We don't like to think about this, but it happens all the time, every day in a health ministry in a developed country. There has to be a choice about how to allocate your scarce resources, how much towards cancer research, how much towards, you know, this, that, and the other different disability and illness that can affect people all throughout their lives. And when those decisions are made, when the pharmaceutical benefits scheme decides what drugs to take on, it's using QALYs.